Hello, hello, everyone. Happiest of Mondays to some of my favorite folks that I see flowing in to the session. Hey, Teresa. Hey, John. Hey, Casey, my BFF there. Hey, Nayeli.
Hello.
I see all of my people here. Hey, everyone. Happy Monday. Happy Monday. As always, it's time to get that party started. I really hope that as inundating and busy as Mondays are, that this can be like the highlight of everyone's day. I know it's the highlight. Hey, Teresa. I know that this session is always like the best because it like really kicks off my week in such a great way. All right, so welcome, folks. This is our, oh my God, 9th session for CPI. This year is going by incredibly too quickly. If we go to the next slide, as always, we know that this wonderful session is being recorded. Just as a reminder, everyone can access the session recordings on our YouTube channel. We include the link to those recordings in the follow-up email. So if you ever want to go back and review any of the information that's shared in this session, or you want to just hear something a second time, so that way it can just like land and resonate, you do have access to that in our shared stakeholder folder and on our CPI YouTube channel. And we'll share that link in the follow-up email. If we go to the next slide, as always, we just want to quickly go over some housekeeping items to please update your Zoom name. We like to have a very personable and intimate space here at the San Joaquin Stanislaus Collaborative. So please go ahead and update your Zoom name. Make sure you include your pronouns and the name of your organization. We're going to have a very quick chat icebreaker. I'm going to go ahead and drop this in the chat for y'all right now. And the question is, if you could hang out with any cartoon character, who would you hang out with and why? You're
Mona
making
Lisa
who
at
is that
3:30
friend?
pickup, return right.
And I'm sorry, for anyone that is not on mute, if you all could just smash that mute button really fast. Perfect. Thank you all so much. I appreciate that. And as I noted in the chat, we have our check-in question, which is if you could hang out with any cartoon character, who would you hang out with and why? Yeah, go ahead and let's like break the ice today by participating in that quick little check-in. And most importantly, just remember, we like to engage. So whether that be you engaging in the chat with one another, engaging in the chat with the facilitators, or just coming off mute to ask a question or to like share a follow-up or reflection, please feel more than free to engage. We always like to have incredibly dynamic sessions. We like to collaborate and coordinate one another. So please just feel more than free to engage. All right, so moving on to just welcoming anyone that is new to the collaborative. And if we go to the next slide, I just want to say, welcome. If you are new to the collaborative, thank you for joining us in this space. This is a dedicated space to identifying CalAIM challenges and working together to problem solve in an outcomes-driven space. Once again, just as a reminder, we do have a shared program folder. So if you want to access any of the resources, including the slide deck that's being used today, please click on the link inside of this deck, and we'll make sure that we have that in the chat for you. All right, so moving on to our objectives for today. Like I stated, this is session 9, y'all. We have been working together for quite some time, and it's an important session because this is our segue into the final quarter of this work. Yes, that is insane. At least this work for 2023, that is. So for today, we really want to prioritize 3 things. Number 1, we want to understand what it is that we learned from the in-person session. So just a few weeks ago, we all met together, we congregated, we problem solved, we networked. What were the outcomes of that session, and how can those lessons inform future planning? So that's the first thing that we'll do. The second thing that we will do is we're going to review our issue areas and our progress to date in order to prioritize actions for the end of this year. We've worked on a number of things together for pre-contracted organizations and for organizations that are currently contracted or work with contracted organizations. And so we want to see, okay, what have we done to date? What tests of change and best practices and promising practices and actions and even policy changes on DHCS's front have been implemented. And where do we go from here? Like, what does all of this mean? What do we do next? And then lastly, there are some new funding opportunities that are really exciting. And so we want to make sure that we share that information with you all. And there's also a new DHCS resource, 2 new resources actually. So we just want to make sure that you both have, or that you have access to both of those resources. And if we move on to the next slide, in order to meet our objectives for the day, this is the agenda that we're going to follow. So part 1, we're going to review the outcomes of the stakeholder brunch that was in person. So we'll review those lessons and that survey that you participated in. Part 2, we'll review what we've done in CPI, and we'll also review the survey results of an assessment, essentially, that was administered by DHCS a few months ago. We asked you all to complete a survey from DHCS to let us know how the collaborative was doing, whether or not we were being successful, and we have the results of that survey. And so we wanted to make sure we're able to share that information with you because we didn't have enough time in our jam-packed in-person agenda to be able to share all of that information. Lastly, following up on the in-person session, everyone asked if we could prioritize networking and group workshopping today, like for this session. So we're going to do some networking, some group workshopping, and some prioritizing for the final quarter, as I mentioned earlier. And then lastly, we'll cover those funding opportunities in part 4. All right, y'all, all of that being said, let's dive into it. Part 1, your feedback on the stakeholder brunch. So if we go to the next slide, I just want to first say thank y'all. We had an amazing in-person event in French Camp at the HPSJ office, and we had about 58 participants in that session. There was a lot of information sharing, knowledge sharing, a lot of networking, relationship building, a lot of fun. It was really exciting to be able to see all of you in person, to see those organizations and individuals that met one another for the very first time. And we just wanted to extend like an incredibly immense thank you just for participating in that session, making it incredibly successful, and just for all that you all have done to date. And so here are just like a few fun photos for us to reflect and extend gratitude. Going into the actual outcomes of that session, if we go to the next slide, we administered a survey and we had about 18 respondents. And I just wanted to share some of this feedback with you. So 100% of the respondents stated that they were somewhat very satisfied to somewhat satisfied with the event, while 0% were neutral or dissatisfied. 83% said they were able to gain a stronger understanding of and connection with key partners, which was one of our primary goals, is making sure everyone knew who was who, so that way we could advance those referrals partnerships. So 83% said that they achieved that. 83% received information to improve CalAIM implementation, while 11% received somewhat beneficial information and 6% did not. 61% stated that they somewhat worked towards identifying and resolving challenges, and 72% stated that they identified a test of change to implement. So this is really exciting. We really wanted to make sure that the data drove how we gauge the outcomes of the in-person session. And so this is really exciting. We're super appreciative once again that we were able to get everyone together to have such a successful convening. And I actually just wanted to like pause right here for just a quick moment to ask if anyone wanted to just come, off of mute to share any reflections that they may have had from the in-person session and whether or not this data resonates with you. And so I'll just see if anyone wants to volunteer. And if not, I can look through a few names just to see if there's someone that I recognize that was present. And Sarah, I'm not sure if you came off of mute to provide some feedback or if you just accidentally unmuted. There we go.
It was both, but I'm definitely open to give feedback. Tell me your
Yeah.
question again so I can reframe it in my brain.
Oh, no problem. So we have this data, that we collected from the survey that everyone participated in after the in-person session. 83% were able to successfully network, 83% were able to walk away with some new CalAIM knowledge, 70% identified a test of change. So we just wanted to know, does this resonate with you? What was your experience with the in-person session? I just wanted to call on a few of us just to reflect on how the in-person session went.
So I definitely agree with the numbers. The networking was excellent. I would even give it a 90 because there was a lot of us that didn't know about each other, or a lot of us that kind of were new to services. Knowledge sharing was again at that level of probably in the 90s. In my experience, just new to the county, new to some of the services, and kind of exposing each other to the services that we all provide was really, really helpful and beneficial. Problem solving, I think that I would give it a 70. So it is in that range. We were able to tackle some of the familiar problems that we all kind of go through, and just strategize some problem solving that we all, came to the table with. And making the change, I think I would put that at 100%. I think we were all there with an intent and a purpose to change, to make that change within this county. So that would be my feedback. Thank you for calling on me, and I'm happy that I accidentally unmuted myself to share this and kick off our meeting. Thank you.
Thank you so much, Sarah. I really, really appreciate that feedback. And that's on behalf of like the entire Health Begins team. And so, yeah, anyone else, maybe like just one or two more individuals that participated in the in-person session, just to let us know how you all felt it went. And any reflections that you have just seeing like some of these survey outcomes. And there we go. I see my best friend over there, Casey. What are your thoughts?
I would honestly say the networking and knowledge sharing was amazing. I think for me, it's like I want to take it to the next level of the speed networking to more like speed marriaging. Just because I think there's so many of us that are trying to do so many great and amazing things, really getting to know more about each other and how we can link and support each other, just so that way we can make a stronger community. I think really drives a lot of everything that we went and learned and were exposed to with this in person. The problem solving, we all are at different levels, which kind of makes it really interesting. And I think one of the other ways that we can enhance that is utilizing all of our experience and levels to help support each other through the process. And I think that that might help make it a little bit easier for some of us that are still in the early contracting phase, implementation, execution, billing, all of that, where we can adjust the problem solving versus just those that are in that point, to bring in people that are already past that point or well beyond that point to figure out how they overcame it, they work through it. And then making changes. I think if we put all this together, we're all going to make the changes that we want to see have happen.
I really, really appreciate this. And I also appreciate, Casey, how you're actually able to tie this into the rest of the session so far as it pertains to, being able to connect those individuals and those organizations that have already experienced A, B, and C, because we are at different levels. However, those organizations that might have experience with A, they might need support with B, and being able to create those linkages, right, between the organizations themselves to advance that problem solving. And so I really appreciate that segue. And if we move into and thank you both to Sarah and to Casey for that feedback, we really appreciate it. And if we move into the next slide, I just wanted to spend maybe one more minute, maybe two tops over just like the rest of the data that came out of the high level data that came out of the in-person session. So some of the highlights that you all shared were being able to meet MCP partners, connecting with new people, the facilitation, having all of the providers in one space, and better understanding who is who, which was like really one of the goals that we had. We wanted everyone to have a better understanding of the provider network. And some of the tests that you all shared that you are doing coming out of this session is leveraging funding to fill workforce gaps, such as hiring patient navigators, delivering peer-in services to increase service awareness, exploring case conferencing with Turning Point. I was really excited to see that was someone's test of change they're going to reach out to, Teresa. Learning about cost estimation, applying for additional cited funds, utilizing the contracting best practices guide. And let me just pick one more, setting up networking meetings to advance new relationships. So thank you, John, as well, for all of those amazing best practices surrounding just how to advance referrals pipelines and how to build out successful networks. We do have all of the data from this survey linked to the slide deck. We'll drop the slide deck inside of the chat so you can have all of the data. It's really exciting because it also includes tests of change that organizations are putting forward to improve program implementation. But importantly, we also stated that we were going to summarize or aggregate and summarize all of the group conversations that occurred. So there was a capacity building conversation, an outreach and awareness conversation, program operations and contracting. And so also included on this slide is a summary of all of the issues that were discussed and the test of change that were recommended for various organizations to try out to improve, their experience with CalAIM. And then very quickly, just recapping the very last two slides in this section, if we go to the next slide, you gave us some recommendations across 2 tiers. So number 1, you stated that as a result of this in-person meeting that you want more networking, you want more MCP Q&A, and you want more peer-to-peer workshopping. So we're going to spend the majority of this session doing precisely that, the networking, the peer workshopping. And then on the next slide, you recommended some systems-wide recommendations. And so these are the recommendations that we're uplifting to DHCS, just as we have been throughout the year, which has led to some substantive change in the policy guides. So we have the recommendations on how you want to use those outcomes to inform this space. And on the other side, we have the recommendations that you are presenting to improve the system or the systems-wide changes that you want to see. And so some of those system-wide changes include hub models. Everyone wants to see more subcontracting, essentially intermediaries for financial and administrative processes to reduce that burden. You want to see marketing, the marketing of services and eligibility. You want a CalAIM 211, like an information line where members can call in to find out what they qualify for. You want faster funding processes, standardization, and member-facing education. So this is, very high level, very truncated, but we are going to continue these conversations and make sure that we uplift these needs with specificity to DHCS as DHCS continues to work towards just making sure CalAIM is being improved statewide. And then lastly, which was one of the biggest questions that we received, is when we're doing this again. And so the vast majority of survey respondents stated that the length of the session was perfect and that the venue was perfect. And so this is the official save the date. So yay, super excited that we will get to do this again. Please mark your calendars for Wednesday, November 15th, the same time, the same place. We will send out something more official in the post-event email, but we did just want to bring you all this information as to what came out of that in-person event and let you know that we are listening. We want to be incredibly responsive to what you are saying is important and that we are trying to do this again sooner than later as a direct result of this being what the collaborative wants and needs. And that is all for the in-person session. So moving on to some more feedback that we have received from the collaborative directly. So the first few minutes, we just covered what came out of the in-person session. But during these next 5 minutes, we're going to cover, or 5 to 10 minutes, we're going to cover what you have shared with us thus far to date about CPI at large. In approximately June, DHCS solicited a survey and asked for your feedback on how we have been progressing as a collaborative. So at the beginning of this work, just to do a little bit of level setting, you all stated that referrals, authorizations, claims, and rates were like some of the foremost challenges for those organizations that are already contracted and or are working with contracted organizations. So as a result of you sharing like these 4 issue areas, we prioritized identifying like solutions, test of change, and promising practices to mediate these issues. Like I said, we're going to drop if we haven't already, we'll drop the link to this slide deck in the chat. Please don't feel, pressured to read this at this time. We've covered this exhaustively. We're going to provide it in the chat, but we just want to let you know, over the past few months, these are the core issues that have been uplifted. These are some of the solutions and changes that have been implemented to improve your experience in these areas for contracted orgs. Moving on to the next slide, we also had core issues for pre-contracted organizations. So for those pre-contracted organizations, you really identified provider education, upfront funding, ROI and VOI, and equity as the core areas of priority for pre-contracted organizations. Once again, as a result of that feedback, these are the specific pieces of like guidance and feedback that we have put forward, such as Health Begins devising or designing a best practices guide for contracting, for upfront funding. Pre-contracted organizations can apply for cited funds after receiving attestation, so on and so forth. And so if we go on to the next slide, like I said, we're not going to go into details on those specific pieces of information right now. Shiva, we can go to one more slide. Thank you so much. But I just wanted to quickly recap, like you've called out these issue areas, and DHCS asked you to provide them with feedback on how we are resolving and working towards resolving and identifying solutions in these issue areas. So I wanted to provide you with feedback on this. So we had approximately 93% facilitation score. So out of 5 in total, we scored a 4.67 for our performance. So we really appreciate that. We are really trying hard to make sure that we're listening to all of the needs that stakeholders are putting forth and being responsive to those needs. So we really appreciate that score. So far as how we're working towards making improvements, approximately 83% of you stated that the San Joaquin Stanislaus Collaborative has led to your organization implementing a specific test of change or an improvement. Once again, really excited about that, hoping we can get that number even higher. You have rated your overall CPI experience a 4.6 out of 5, and 100% of survey respondents stated that this collaborative is action-oriented. Just as a quick flag, we only had about 6 stakeholders complete this survey. There was low survey participation across the state. So I just want to give an early plug that we are going to administer this survey again in December, and we're hoping that we can have higher participation at that time. So what does all of this mean? We received your feedback from the in-person session. We looked at the data as to whether or not that in-person session was successful. We learned that stakeholders want more of this networking, and to transition that networking into this group thought partnering, this peer mentoring to solve problems based on our own experiences. And we also see that from DHCS's survey that you do believe that the collaborative is being action-oriented. So with all of that like in mind, where do we want to go next? We have a remaining quarter together. We have, more issues that we want to resolve and we want to solve. And so we need to really prioritize what we're going to focus on. And so as a part of our breakout groups that we're going to start in just 1 to 2 minutes, we're going to spend that time with each organization. Number 1, networking. So that way we can continue to build upon what we started and successfully did in the in-person session. We're going to have some group workshopping where we're going to get to ask the entire group, or excuse me, each individual or each org will be able to ask the group a question pertaining to a challenge that you are facing, to really have some of that group workshopping. And then number 3, based on the questions that you're asking, we really need feedback from you to let us know, what is your priority? What is your core challenge that you're facing right now? What do we need to prioritize at the next in-person session for problem solving and for the remainder of this year? Like, what do we need to focus on? So just a quick recap, we're going to split into breakout rooms. We're going to, number 1, conduct some networking. We're going to do some intros. Number 2, everyone's going to have an opportunity to ask the group a question to really have some thought partnership and some workshopping. And number 3, we're going to do some priority setting so that way we can understand exactly where everyone is and what your needs are. And before we do that, if we go to the next slide, I just wanted to provide a really important update that we are bringing on additional resources to support quality improvement. We are realizing that a lot of organizations really need QI support right now, support with designing PDSA, support with designing improvement practices. And so we are making sure that we're pulling in the resources to properly achieve that. And so I'm going to ask Sarah Bader, the Director of Training Programs at Health, begins to conduct a quick intro and let us know how she's going to support us with QI in this last quarter. And she will also join us for the breakout room discussions, just to be a fly on the wall, listen to where the collab is right now, and just determine how to plug in and how to support us. And so, Sarah, if you could give us a brief intro, that would be super great.
Yeah, thanks so much, Alexis. And hi, everyone. It's really wonderful to meet you. I'm excited to go into breakouts with you and get to know you even more. I've heard wonderful things from Alexis and Eva and Shiva and the team. And so really looking forward to kind of diving in to this with you. Just to introduce myself really quickly. So I'm an urban planner by training, and I started my career working in urban planning. Transitioned pretty early on into healthcare and spent most of my time in healthcare actually working in quality improvement. So I've been doing quality improvement coaching for over 10 years now, which I can't really accept that I'm old enough to have done anything for over 10 years, but QI coaching has been a constant. It brings me a lot of joy. I love seeing kind of the learnings that can come from kind of rapidly testing and how we can scale quickly. And so through this, I'm just excited to kind of support you on your QI and PDSA journeys here as you look to improve and implement and change. And so as Alexis mentioned, I'll be kind of hopping in and out of your breakout rooms just to get to know you. But of course, feel free to ask any questions that you have. And I'm looking forward to engaging with you more closely in the months to come.
Perfect. Thank you so much, Sarah. And that being said, we're going to dive into 2 breakout rooms just to continue like that networking, that problem solving and prioritizing for the rest of the quarter. And so Shiva is going to break us up, and you should see that notification coming within just a few seconds. Oh. All right, everyone, the Zoom whiplash. We are all back in the main breakout. All right. Oh my gosh, those were some really great conversations, everyone. Truly appreciated. I hope that a lot of networking took place in each one of these rooms. And if we actually go to the next slide, yeah, before we dive into some funding opportunities, does anyone just have like any reflections coming out of the breakout rooms? Anything that you want to just, I don't know, like share back with the entire group pertaining to some of the new partners you may have met or some of the challenges that you may have uplifted? Anything notable for any of you?
I would like to share a brief, praise report testimonial if time permits. So when coming on board with Health Plan of San Joaquin, one of our first members that we served, the gentleman had cataracts in both eyes, was blind 100%, and seeing him through that process of his 90-day stay in recuperative care and watching him be gifted and have his sight restored was just an awesome process. And just to be able to see somebody come through the other side of that, get to where they're able to manage their diabetes and drop their numbers from, we were looking at levels of blood sugar from 400 and up down to, in the area of 127, 137, and his sight restored on top of it, and leave here smiling and able to see was just, that's what these programs are about, I think. And that's what the type of service I think is what we all are aiming to provide for these clients.
I really appreciate that, Justin, so much. That in addition to the feedback that you shared about how you have been able to conduct those trainings at the local hospitals in order to build those relationships and have those social workers, those 5 to 6 that you mentioned that you work with, in order to keep the services circulating that base that needs them and making sure that the access is there. And that was just incredibly helpful information that we'll make sure that we share with the rest of the team as well, because I know peer organizations can benefit from those processes that you all are using. So I really appreciate that feedback. That being said, everyone, Before I dive into just this final section on some new funding opportunities and resources, is there anyone else that has anything that they want to share or reflect on? I know one of my reflections is that the conversation is shifting, and that's been really exciting. At the top of this year, I felt like there were more challenges than solutions. And as of right now, there are a lot of organizations that have put forward various test and improvement strategies in order to improve how program implementation is working for their teams. And I really enjoy being able to see just the fruit of those efforts. It's really exciting and super just happy for everyone here. All right, and if there is nothing to share, we're just going to go over some funding opportunities. All right, so let's go to the next slide. So the first thing that we would like to uplift is the Equity and Practice Transformation Payment Program. DHCS is launching a $750 million EPT payment program for primary care practices. Inside of this deck, we have included a link to the actual application. We've included 3 links: a link to the application itself, a link to a preliminary Q&A that DHCS hosted with some initial questions that stakeholders or potential applicants might have in order to, help address some of those questions. And then also I've included a link to some informal notes on this slide deck as well. I don't know if everyone had an opportunity to attend a webinar that took place approximately a week or 2 ago discussing this Equity and Practice Transformation Program, but there were a lot of questions, on behalf of providers. I'm just trying to better understand what this program is. And so I tried my best to scribe responses to those questions. And so I aggregated those, summarized them, and also link them to the slide deck so that way you could have access to them. But importantly, I'm saying this with the preface of, if you have any additional questions about those notes, please just go directly to the landing page for EPT and ask those questions to their inbox so that way you can get any of the clarity that you need as you review those documents and review this information. So the basic information is that this is a delivery system transformation program to improve health equity outcomes, and that you should apply if you're a small primary care provider that serves Medi-Cal members. The deadline for the application is going to be October 23rd, and they have multiple focus areas for this program, specific domains to which you can apply for funding. And those domains are listed directly on the website. So once again, the application is going to be due October 23rd. It's for small primary care providers that serve Medi-Cal members, and the purpose is specifically to improve health equity outcomes. And this is a part of DHCS's goal to achieve their quality improvement strategy, their bold goals, which is 50 by 25, and you can see that information directly on the screen. So that is the first new funding opportunity that's available, and you can review all of that information on this slide. Second, we are going to go to a stipend opportunity. So the Camden Coalition sponsors the annual Putting Care at the Center conference every year. This year it's going to be in Boston from the 1st through the 3rd, and there are scholarships available from the California Healthcare Foundation to support community-based organizations and being able to attend that conference. So we know whenever there's a conference, there are costs that are associated with that. The actual cost of registration, the flights, the stays themselves, food, so on and so forth. And so essentially, CHCF and the Camden Coalition realize that there is an immense value in CBOs and MCPs being able to attend in partnership. So if you are a contracted provider with an MCP, you can contact your MCP directly to see if you can partner on submitting an application for this scholarship. And the focus of this specific conference and is going to be leading with lived experience, understanding behavioral health and complex care, and various workshops are going to range those topics, complex care, and leading with lived experience. And so going back to the financial components, the scholarship itself is going to cover the registration costs for the conference, your hotel, and it's going to provide a stipend towards your travel expenses. And so you do need to be once again, a contracted provider, and you can work with your managed care plan in order to see if you can submit an application, if they will sponsor you to submit this application. And we've included the links to the scholarship and the links to the Centering Care Conference, so you can read all about it on this slide as well. And then lastly, the new resource that we just wanted to uplift to everyone is going to be the CS and the ECM cheat sheet. So DHCS released all of those policy revisions, but everyone still stated that it's a lot of information to process. We summarized that information and provided those updates here in the CPI session. However, DHCS also took point on developing a cheat sheet, so that way you wouldn't have to review hundreds of pages of policy guides, right? I know you all like to read those policy guides with your morning cup of coffee, but some of us don't. And so they were able to develop a cheat sheet, and there's 3 parts to the cheat sheet. So if you see on the screen right now, there's an upper header that tells you what the policy pertains to. So does it pertain to identifying members, the delivery of ECM, data requirements, provider networks, payments, so on and so forth. So that's the first part when you access this cheat sheet. What does the policy pertain to? The second part of the policy is how standard the policy is. If there is low standardization, it means that there is more flexibility on behalf of the MCP to have flexibility in that area. If there is high standardization, that means it's working towards more standardization, right? The MCP has less flexibility in that area. So like I said, number 1, the cheat sheet has what policy area it is. Number 2, how the level of standardization for the policy. And importantly, number 3, a summary of the policy. So that way you know how to use it in practice in lieu of having to either hunt for it in the policy guide or read the entire section of the policy guide. So this cheat sheet is linked to this deck. So that way, as you all are developing those internal workflows and processes, you can refer to the cheat sheet in lieu of having to read the exhaustive policy guide. But of course, where there are additional clarifications needed, the policy guides are still an incredibly helpful resource. The last resource that I wanted to mention, I don't have a slide for, but it is linked at the bottom of the slide deck. We don't have to review it right now, but it's just going to be the funding cheat sheet. There's also that available for you in the resources, and it has just a synopsis of funding available, where those funding opportunities are in the timeline, and how you can access or apply for those funds. And so that's it for today, everyone. So we were able to recap, everything that we've done today in order to conduct some planning for the next quarter of this work. We received a lot of insights as to what you want to prioritize and what your thoughts are preliminarily for us thinking about next year. And so we just want to launch a very quick poll to ask everyone what the most valuable part of today's meeting was. Was it reviewing those learnings and the surveys or the results on the surveys that we conducted? Was it the networking? Was it the priority setting? Please let us know so that way we can make sure that we continue in a way that is most beneficial to you. And I will give you about 30 more seconds to provide your feedback there. And I'm not surprised that networking is still leading the way. It is still leading the way, y'all. Okay. Thank you so much. So 92%, 93% said networking. That's great. Okay, that's super great. And so, as always, please conduct your PDSAs. The link to the PDSA template is inside of the slide deck. We've discussed a lot of tests of change, emerging practices, and best practices. Please determine what your organization is going to do next. Put it into practice, study it, and determine whether or not it's a practice that needs to be scaled. We will send out a post-event email as always. If we go to the next slide, that includes the registration information for the upcoming session, a summary of the funding and resources that we provided today, a link to the upcoming office hours, and then just the email address that you can use if you want to schedule a one-on-one. And yeah, that's it, everyone. Thank you all so incredibly much. As always, you all are immensely appreciated, and we will catch you all the next time. Thank you all so much.
Thank you.
Thank you.
Bye, everyone.